Dr. Franz, we are at this moment in a multiple risk moment. There is COVID, but there is influenza. We are in winter, and we are near of a holiday celebration, near holidays. How we can enforce all of these social distance rules to avoid getting the coronavirus?
It's a good question. You know, it really is about creating distance. And to do that, it all starts with the individual. We all have the responsibility to our families, to our loved ones, to stay protected so that we don't get sick, so we don't bring it home, we don't bring it to our households and share it with others. And so to do that, of course, we have to follow our local public health recommendations. First, we need to stay with our households. We need to be with the people in our households. We should not be meeting up with other people, getting gatherings together. Even our extended family, we shouldn't be having families come together unless you're certain that those other family members have been safe and careful for the last 2 weeks. That's very hard to do. So at this point, we really want you to stay only within your households. When you do go out, you must wear a mask when you're out, when you're in stores, if you're in a working environment. Indoors, we expect you to wear a mask because we know that wearing a mask will reduce your chance of spreading it to others and will reduce your chance of getting it. And then finally, if you're feeling sick, you have a headache, bit of a sore throat, dry cough, then go get tested. We want to be sure we know that you have it or not. If you have it, you need to stay home for 10 to 14 days. And if you are exposed to somebody, a family member or a friend who has COVID, you need to stay home for 14 days. And if you develop symptoms, get tested. So wear your mask, stay in your household, stay home if you're sick, and get tested. Those are the key things that we should be doing to protect ourselves and our family members.
Dr. Francis, why there are more incidents or more number of coronavirus during the winter or the beginning of winter? Because at the beginning of the pandemic, all authorities were telling us, okay, we need to wait until summer because there will be a decrease on the cases. And now we are again on winter. And then what is that? Explain to us why there is a relationship or connection between weather or the lower degrees and the more cases.
Well, you're right. Over the summer, the cases were very low. We would have maybe 300 cases a day in the state. And now it's more like 3,000, 4,000 cases a day. And this virus is a respiratory virus. And it is spread by talking, by singing, by laughing. It's in small droplets that come out of your mouth and your nose when you're speaking. And if I'm outside, those droplets get blown away in the wind and they don't infect the person I'm speaking with. In the wintertime, we spend more time inside. And when we come inside and we're talking, laughing, singing, those droplets are in the room. And other people are in that room for 15 minutes, 30 minutes, an hour. They'll breathe in those droplets and then they can get sick themselves. And what's so challenging is that half of people who have this virus feel fine. They don't have any symptoms. So now they're inside and they feel fine, but they're spreading this virus in their droplets as they talk or laugh. And so during the winter, it means that we're going to have more cases as people come inside where the ventilation isn't as good.
What is the main differences between the Pfizer vaccine and Moderna vaccine?
The Pfizer vaccine and the Moderna vaccine are very similar. They both are newer vaccines and they both seem to work very well. One of the major differences is how we store the vaccines. The Pfizer vaccine needs to be stored in an ultra cold freezer, minus 90 degrees Celsius, very cold. We have 10 spots across the state of Colorado where we can store this Pfizer vaccine in an ultra cold system. The Moderna vaccine needs to be kept frozen. So it's more like the freezer in our refrigerators at home. And so that's a little bit easier to store. Once you take them out of the freezers, they have a certain shelf life where they still work for a certain period. With the Pfizer vaccine, I put dry ice around it and I take it from the storage to a doctor's office or to a hospital and thaw it out and then give the vaccine. And it will be the same for Moderna's vaccine. They will be stored in freezers. And once they're out of the freezer, they have, and they're sitting on your shelf 12 hours before they have to be thrown away. So it will be important that we organize everything so that once these vaccines are thawed and come up to room temperature, we use them all because we don't want to waste any.
The phase 3 of both and even the other haven't finished because we are listening to both companies are still inviting people to participate in phase 3. So could you talk to us about the level of certainty of the efficacy of these two vaccines?
Yes, you're right. The phase 3 trials are still going on for both of these studies. And they're very important. These are the studies that have tens of thousands of people in them. Half of them get an inert placebo. It's not the vaccine. Half of them get the real vaccine. And then they don't know who got what. They follow them forward in time and they look, are there more cases of COVID in the people with the placebo, or did they happen equally with the vaccine? And that helps us understand how well the vaccine worked. So Moderna told us, I believe, that of 95 cases of COVID, 5 of them were in the arm that got the vaccine and 90 of them were in the placebo arm. So the vaccine was 95% effective at preventing COVID. The other thing about these studies is that they look at how safe the vaccine is. Do the people who get the vaccine get more of a sore arm or a fever or a headache because they got the vaccine versus the people with the placebo? And they can compare the two. They can even look for unusual, more serious side effects. Did any of those happen with the vaccine more than with the placebo? So the phase 3 trials are very important. They show us that they work and they show us that they're safe. And those are going to go on over the next few months. There is a desire to get effective vaccine out into our community as soon as we can. And so if we look early in the phase 3 study and we see that it's working and it seems to be safe, then let's go ahead and start giving vaccines rather than having to wait all the way to the end of the study. The study will still go on, we'll still have the final results, but let's go ahead and give people the vaccines because it looks effective and safe now, and that might save lives.
Imagine that we are now in January 2021. So what is your vision about this moment? What is the best scenario that you would like that the Colorado are living at that moment?
I think the best scenario for me is that we have vaccine in the state, and that between November and January, each one of us is doing what we should be doing to keep the virus from spreading. We're staying in our households, we're wearing masks, so that in January, our hospitals have not been overrun. We're still doing pretty well. And in December, we got our first doses of the vaccine and we gave it to our healthcare workers and our first responders, the paramedics and EMTs, so that everybody who's taking care of us in the hospital is protected. That would be my ideal for January. Then in January and February, we'll still get more shipments of vaccine coming, and we'll start giving it to people in the more general public. It will be people who live in nursing homes who are at risk of getting it. it will be people who are essential workers. So our grocery store workers, our transportation workers, the people who have to do things to keep our communities going, they'll be vaccinated in January and February. Then maybe by February, March, people who have higher risks like diabetes and asthma and high blood pressure, maybe there'll be enough virus then to vaccinate them. And then finally, in April, there will be vaccine coming, and people who are healthy, who don't have any risk factors, will then be vaccinated over the spring and early summer. So I'm hopeful and I'm encouraged that we are expecting tens of millions of doses to start shipping in December, January, February across the United States.
Dr. Franz, thank you for your information and good luck in all of this effort that you are doing for keeping us safe during this pandemic.
Thank you. And thank you for all of the work you're doing to tell this story and to remind families the importance of keeping everybody safe by doing the right behaviors.